Australians are on track to eliminate cervical cancer by 2035. However, in order to do that, all the women and young girls coming through the ranks need to get their cervical screening test, but also need to be vaccinated.
Anyone who's sexually active who has potentially been exposed to the HPV virus.
If you're in the age group between 25 and 74 and you haven't had a cervical screening test, then you're overdue to have that screening test performed, and you really should make an appointment with your doctor as a priority and get the screening test done.
They still need to have a cervical screening test because if they have had the older version of the vaccine, it doesn't actually target all HPV that we're finding in testing. So it is good to have the cervical screening test.
Women might perceive it as the less frequent the better. The testing time has changed from 2 years to a 5-year interval for testing. I think that's even more of a reason for young women to get tested.
It's much better to get it done on time, all the time.
Be supportive, just educate themselves on the topic, understand the relationship between HPV and cervical cancer, understand what's involved in actually collecting a cervical screening test.
I think a lot of women put themselves second. You know, we're all very busy, we have jobs, we have kids, and we always think that's possibly more important than looking after ourselves.
When it comes to cervical screening, that's something that really rarely comes up. And I think that even if it does come up in conversation, there is a big focus on the negative side of it. So the awkwardness, embarrassment may be associated with the testing, but it is a really important test, and I would encourage young women to make the effort to go and get tested.
I often find when I instigate conversations with my girlfriends, I find that a lot of them haven't because they don't want to go there, they think it's embarrassing, they're not really sure what to expect, they don't realise that it's actually something really important to do for your health. I do try to encourage them to go ahead and get it done and tell them that it's actually quite a painless, easy procedure to have done.
It's a simple test and it could save you so much pain in the future.